Hello everyone. In this video I'll be doing a review of my emrcs subscription, and I'll also be showing you how I actually work on it. So for that I'll be using Google to go to emrcs website. Sometimes I might be scrolling the screen a little fast to make the video short. So at any point if you want to read any information on the screen, you can just pause the video. So this is the link for emrcs website. And this is how the website looks. You have option for sign up here if you don't have an account. So now I'll sign in into my account. For that I'll be entering my email ID and password. I have talked about the price of this subscription at the end of the video, so you can have a look at that. So now my password, and now login. So this is how the page looks. These are all the topics that we have, and we have the number of questions that are available for each topic, and you can also see the number of questions that I have attempted. Suppose in this orthopedics, you can see that I have attempted 18 questions out of 68 questions, and these green and red bars that you can see on each topics, they tell you about the number of right and wrong answers that I have marked, and it also tells you about your next date of exam and your percentile. So here you have one setting where you can put a time limit on each of your questions. It means you'll have a fixed amount of time to solve each question. And okay, so now let's go to our question, and I'll be solving 3 questions to just show you how it works. So let's select emergency medicine and trauma. So we'll start our question. So I'll be solving the question at the same time, and because I'll also be reading the question for the first time, so I might take a lot of time. So you can also just solve the question. A 45-year-old man is admitted after his clothing caught fire. He suffers a full thickness circumferential burn to his lower thigh. He complains of increasing pain in lower leg, and on examination there is paresthesia and severe pain in the lower leg. Foot pulses are normal. What is the most likely explanation? Compartment syndrome. Let's see. So a lot of people mark this answer right. So you can see thickness of this green bar, and now you can read about compartment syndrome. That's a very nice setting that they have given, that at the end of the question they give you something to read about it. So you can see here they have a lot of information regarding burns. And you'll see, if you solve all these questions, you'll see that the same information they'll be repeating after many questions. So now the next question. An 18-year-old male is shot in the left chest. He was unstable, but his blood pressure has improved with 1 liter of crystalloid. His chest x-ray shows a left-sided pneumothorax with no visible lung. What is the best course of action? So for this question, I just remember one thing, that we insert a needle in the intercostal space, and we also put a chest drain, but I don't know about the size, so I'll go for 14. Oh, it's wrong. So see, this is the wrong answer that I have marked. It shows with red, and the green one is the right answer. 36 chest drain is the right answer. So now you can read about this pneumothorax. at the end of each question they give you this information, and they'll be repeating the same piece of information after many questions because these are common to many questions. So here you can also make your notes, but I don't make it. I have never used this feature, but they. So now we have the next question. A 28-year-old African male is admitted with acute severe abdominal pain. He has just flown into UK long haul and the pain developed while in flight. On examination, he is tender in the left upper quadrant. His blood tests are as shown. Hemoglobin 6, reticulocyte 15%, USG of spleen shows heterogeneous texture. Gallbladder shows a few small gallstones, but otherwise normal. In this option, I'll go for sickle cell anemia because he's coming from Africa and all other things they don't fit into this. So I'll go for sickle cell anemia. Yeah, it's right. So yeah, now here you can read about sickle cell anemia. They have given all the information, and using this you can solve many other questions will be coming. And okay, so at any point if you want to just exit, you can just press back and then you can just exit. So this you can see now that I have solved 3 questions out of 94 questions from emergency and trauma. So this is how it looks. They have also given one feature where you can search for any topic. I never use this because I don't know why. So I'll just show you how it works by searching about HIV. So let's see how it works. So here they have given you about HIV testing, HIV, biliary and pancreatic disease. Let's see this. So here they have given you information about biliary and pancreatic disease in HIV and then HIV testing. So this one is also a good feature that they have given. You can again make notes here. Okay, so this was good. Now let's see parotid gland. Okay, I've seen this previously before at the end of one question, I remember. So this is the same piece of information that they give at the end of each question. You can read them directly from here. Okay, that is good. Again, you can save your notes. Now let's close this textbook. Now as you can see, there are around 2261 MCQs, out of which I have attempted 72. Let's log out. So it cost me £35, and for that I had to make a PayPal account. For 4 months I had to pay £35, and I could not pay using other means, so that's why I had to make a PayPal account. This is what I had to pay in Indian currency. Do give me a thumbs up and take care. Bye bye.